What questions would you personally ask a home care company?
Well, I would ask a lot of questions about their aides themselves. You want to make sure that they are background screened. You want to make sure you're bringing people into your home that are safe. And are they CPR and first aid certified? That's important. We want to make sure they know what to do in an emergency and what sort of training and experience they have. What do you teach them to do when they're faced with a tough situation? For example, if your loved one has Alzheimer's, you might ask them, well, what do you teach them to do if their Alzheimer's person is a little combative or aggressive, so that you know what they would do in those instances. Things like continuity of care. Are we going to see a new face every day, or are you going to be able to get me one or two people, so that your loved one gets to know your caretaker and can bond and make that connection. Do some additional training with our caregivers. A lot of non-medical companies, they don't dive into the medical side, but each of our girls come and meet with me one-on-one. And we talk about the normal things like ambulating and bathing, but we also talk about specific diagnoses. So they learn, if your client's diabetic, what are some of the signs that their sugar might be dropping, and what are we going to do about it? If their client has a seizure, how are they going to keep them safe? About Parkinson's and hospice and some of the things they're going to come across in those situations. So we try to really prepare them for a lot of those emergency situations. I mean, one of the big ones I see a lot, all of our girls are CPR certified, but one of the things they don't teach you in that class is, what if your client's in a wheelchair and you can't do CPR from the wheelchair? So how are you going to get them onto the ground safely without both of you ending up on the ground? I don't want them to be in that situation and
Right.
be panicking and trying to figure out how to do it. So I try to give them the tools they need to be able to react appropriately when they come across those situations.